Governor, you didn't mention medical marijuana. Is that a priority? Do you want a bill in the week?
Well, I hope to get a bill I can sign. I hope to get one that Minnesota Medical Association supports. I think it's very important. If the legislature is going to prescribe medical treatments for patients, then I think they owe it to the safety of the people of Minnesota to take into special consideration the views of the predominant views of doctors around the state. And I hope that they'll enlist Commissioner Ed Ellinger, who's a medical doctor, whose specialty is public health, who has a lot of experience in this. He was engaged with the House for some time and made a number of, I believe, improvements in their legislation. And I hope he'll have the chance to do the same with the Senate. And I hope they'll work out a bill that we can all support.
Are you involved in negotiations on that, or are you going to just sit back and see what they send you?
Well, I'm through Commissioner Ellinger and through my chief of staff, Jamie Tinscher. We were definitely involved and continue to be involved in the House side. We reached out to the Senate side, and Senator Dibble's been indicated his interest in working out something cooperatively together. So I'm hopeful that will continue, and if so, I think we'll end up with, I'm hopeful, with a bill that can be I can sign.
Governor, what is it about the Senate bill that you are reluctant to support? You said you like the House bill, but what about the Senate bill?
Well, the Senate bill, I think they brought it down now, but they have 55 distribution sites around the state. Is it down to 30 now, 24? 3 per congressional, so 24. Now it's 24 sites, 3 in each congressional district, where they will have the legal authority to grow marijuana plants, and then people who qualify will have the authority to buy and possess legally up to 2.5 ounces of leaf marijuana, and are ostensibly limited to quote unquote vaping. I don't know if anybody's vaped marijuana leaves. I have no idea, but it's just, to me, impossible to believe that somebody's going to buy 2.5 ounces of marijuana and not smoke it, or not sell it to somebody else who will. I mean, it just defies common sense in my judgment. So, and plus you've got a distribution issue with the security of those enterprises, with the credentials of the staff who are dispensing it, and it counts as medical marijuana, but there's no doctors involved here. There's nobody other than the patient himself or herself assessing, what is the proper dose here, and what is too much, and should I get behind a car after I've had, whatever amount. So it really is. They've gotten very smart at doing using the words to make it sound, alternative treatment center, and some of these other pieces of language that just don't reflect what's really going on.
It appears that the Senate bill has more security provisions than the House bill does, however.
Well, the Senate bill has features that are preferable to the House, and they'll go to conference committee, and where the Senate bill has better security, then I hope that will be included.
Governor, I just want to double check. Are you saying that you are open to some of the provisions of the Senate bill, or is the House bill?
Oh, absolutely. Absolutely. I hope the negotiation here comes forward with the best of each bill.
And do you think there ought to be dispensaries, that many dispensaries, even 24?
The logistical problems of that is something that I don't think anybody has really devoted much time and attention to. The startup costs, I mean, the assumption is there'll be no revenue impact for the state to get these centers set up and operating, and I think that's optimistic. Some of them might do well because of their locations, others in more sparsely populated parts of the state I don't expect to break even. Then we'll have to see what the operating losses are, and who's going to be, in the next legislative session asked to take responsibility for those. Again, the more 24 centers means you have to have, I don't know how many, 6 employees per center. So you've got then what, 144, people out there who have various qualifications and the like. And to think that, I go back to the prescription painkillers Vicodin and oxycodone, which are manufactured by companies under tight restrictions. They're Schedule I U.S. government. They have to be prescribed by a physician, and that prescription has to be filled by a pharmacist and given to the patient with no refills. And that's as tight a control over an illegal substance. Well, I should say, a legal substance that is tempting to be used illegally that we've been able to come up with. And I'm told by law enforcement and others, there's those pills are widely available on the streets throughout the state. So if those tight controls aren't sufficient to prevent the pills from falling in the wrong hands, especially young people, especially people who are vulnerable, who are still developing, then just think that we can distribute leaf marijuana under much more much less restrictive conditions and not end up with something that goes farther. And you talk to, again, people who deal with kids, high school, even younger, who are hooked on marijuana, and it's a very ugly situation. Talk to people who criticize law enforcement for their position, but law enforcement is the one who will go out and respond to the accidents that happen because somebody's driving stoned, which is, they say, similar to effective intoxication. And so, I mean, there's just all these consequences out there. We want to help the people that need help. We want to do anything we can to relieve the pain and suffering of children and adults who suffer from diseases and afflictions that might be helped by medical marijuana, but we want to do it in a way that's not going to open up even more people to greater harm.
Governor, are you glad you raised the profile of this issue? You started the session saying you were against it, and then you met with the advocates and you were more open, and then you said to the Senate, stop hiding behind your desk. You've really raised the profile.
Well, that was the House and the Senate, even more at that point the House, but they both took equal umbrage. That's the process. Yes, it clearly is an issue that's extremely important to many people, and to the testimony or the speeches on the floor, which I think were sincere and heartfelt, and bipartisan support. I mean, shows that everybody has a desire to be compassionate and to do what's right for people who are in the terrible situations that they face. And so, what comes out of this is something that's going to help improve one life or save one life, and as far as I'm concerned, it's well worth it.
Governor, has the debate or the votes that the House of Senate put up some pretty big numbers. Has that swayed you at all in this? The votes in the House and Senate, the large majorities, has that swayed you? And you mentioned the emotional debate.
Well, I'm going to do what I think is right for Minnesota. They vote, and then if it passes, then the executive branch has a responsibility to implement it. So I depend a lot on Commissioner Ellinger, who's got a big heart, but also has the medical training and the public health training to know what's ethical and what's not. What you cannot ask other physicians to do. They're not prescribing this. They're just saying that these people have conditions that qualify them under the law to be able to purchase marijuana. So, there's a big gap there in terms of the liability, and that's something we haven't, looked at yet. If this passes, I'll tend to ask the Attorney General to look at that. I mean, what's the liability for the state if something goes wrong with somebody? So, all of those operational concerns, the cost, whether it's going to be, can be financed by, so Colorado's pointed, I guess Colorado makes money off of, but they legalize it for everybody. And in fact, it's interesting, the governor of Colorado, a Democrat, Hickenlooper, asked if he would advise other states to follow in Colorado's footsteps, and he said I would advise them to wait for a couple of years and see what happens here. So that's not a ringing endorsement of the approach that they've taken, which started as legalizing medical marijuana, and then from what I'm told, at least by some, the breakdown in the control over that system was such that they decided they would probably just to legalize it and make the best of it, make the money off of it, rather than continue to deal with the failure of the controls over just the medical aspect.
It sounds like that's the direction you're going. You would not sign a bill unless you're satisfied that the security and controls are in place?
To the extent possible. I mean, we'll learn from the experience, but I think the House bill with the more limited distribution and the limit to pill form or capsule form is much more likely to be able to be controlled and used appropriately by the people for whom it's intended.
Are you prepared to veto?
I'm not going to use that word at this point, but anything is on the table. I guess I did use it earlier on the sprinklers, but my goal is to come, in this case in particular, to come up with something that has broad acceptance in the medical community, enough at least neutrality in the law enforcement community that obviously has the political support here. We can sign. I can sign it, and we can do the best we can to implement it well.
Do you think intractable pain patients should have access? They would under the Senate.
I don't think I'm not qualified. I think the legislature is qualified to decide who medically qualifies for something whose effects aren't established except anecdotally. I mean, that's why they do extensive research studies and clinical trials, with various medicines before they're made available to the general public, so that even doctors can answer those questions. And even, as I said before, it's been a long time since we had the catastrophe with thalidomide, where it was tested and it actually was, I'm told, beneficial to some people, but it had these catastrophic effects for women in the early stage of pregnancy, and that wasn't detected. Well, they tightened up the procedures a great deal after that, and now we go to the drugstore, at least I do, and get a prescription filled, and I don't think about whether it's going to be safe for me or not if I follow the directions, and it's just that's something we can take for granted, which is great, which is the way we want it to be. So, this has not gone through that kind of scrutiny, that kind of evaluation, and so we have testimonials from people, and they may well be true, but that doesn't mean that it applies to everybody.
Given all that, do you prefer the shorter list of qualifying patients?
I'm not. I want the people who need it and who might benefit from it to have access to it. So I'm not going to say one should be in, one should not. I don't have the expertise to make that assessment.